Okay, so we are doing examination of the abdomen. So first we're just going to do the typical just observing, looking for any obvious signs of infection such as rashes, any scars, bruising, skin discolorations, hair patterns, looking for any visible masses in the abdomen especially. If you see a visible mass, you can have them turn away and cough. And if the mass moves inward and you can't see it anymore, it's an like organ-based mass. And if it moves outward or comes out farther and you can see it better, it's typically either musculature or above the musculature, just under the skin. Then for instrumentation, we are going to listen to bowel sounds, which this is the only time that we do auscultation first, because by pressing on the abdomen you can affect what the internal organs are doing and sounding like. So using the diaphragm, we're going to listen to each of the 4 quadrants for 5 to 15 seconds, listening for normal bowel sounds. Okay, and then we're going to also listen for friction rubs over the liver and spleen. So we're going to use the bell for that, for listening to a deeper sound. And you're going to come just to the base of the rib cage. I'm sorry.
It's okay. I'm like, why are they so cold?
The base of the rib cage on the right side for the liver. Listening to as they breathe in and out for any friction rubs. Then the spleen, same thing but on the left side, coming down to the base of the rib cage. Listening to it as they breathe in and out for the friction rubs. Then we're going to listen to vasculature for bruits with the bell. So we're going to listen to abdominal aorta, renal, iliac, and femoral. So we're going to start abdominal aorta. You can be like an inch or so above the umbilicus. Then renal, you come down an inch and over an inch. You have to do that on both sides. And then iliac just kind of right below the belly button where it splits on both sides. And then femoral. On both sides. Listening for any bruits. Then we'll begin with palpation, since we're done listening and won't affect any of that. So first, you're going to begin just gently and superficial across the 4 quadrants. Where my hand fit? Just feeling for any like muscular skin potential causes, any like masses under the skin. You can assess like muscle tenderness and tightness of the abdominals in this area. Then you're going to palpate deeper across the 4 quadrants. This is feeling for more of those like organ-based masses. And while you're doing this too, we can palpate for the specific organs. So for the liver, you're going to have them you're going to find the base of the rib cage on the right. You're going to have them take a deep breath in, and then all the way out. You can follow it in under the rib cage as it goes in there. Spleen, same thing, except for you shouldn't be able to normally feel the spleen. So this is more just checking to make sure there's not any enlargement of the spleen. So take a deep breath in. That was weird. Okay. So that's for spleen, edge of the liver. Then we're going to do the abdominal pulse. So you're going to come on each side of the abdominal aorta. You're gonna have them take a deep breath in and let it out, and as they let it out, you're gonna come down and feel for the edges of the pulse. To feel for the edges of the aorta, and it shouldn't be more than 3 centimeters wide, else that would indicate an aneurysm. Then we're going to attempt to palpate the kidneys, which is difficult. So you have to use the floating maneuver. So you're going to put one hand under and one hand over, and you're going to push and try and feel for the rebound on the bottom hand. Most people, you probably won't be able to feel kidneys. Okay, then we're going to do percussion. So we're going to go down the 3 lines. So basically right down the middle, and then mid-clavicular, and then the axillary line. So using the arch fingers, you're going to pump it down. Listening for the changes, especially between going over organs. And then specifically it will percuss across the spleen and then the liver. Okay. Oh, and the liver you would do from up to down, and then you would also do from down to up, doing it in both directions. It is so good. I know. Then we're gonna palpate McBurney's point, testing for appendicitis. Any pain with that? No. Okay. So positive would be if there was pain, it would indicate appendicitis. Rebound test, you're checking the farthest opposite one. So if you were thinking appendicitis, you would press into the left upper quadrant and then release and ask them if they felt any pain with the rebound. Then we have the 2 muscle tests for appendicitis. So we have obturator, which I'm just going to raise your knee up and internally or externally rotate the leg. Any pain with that? No. And then psoas, I'll have you face that way. That's okay. I'll find something. And then you'll have them, you're going to just brace them so they don't move their hips, and I'll just have you extend your leg back. Any pain with that? No? Okay. That, if there was pain, that would indicate appendicitis. And that's it.